I'm Helen Eddy, Director of the Polk County Health Department, and I want to thank you for coming here this afternoon and attending today's press conference. As of today, March 16th, 2020, we have 22 positive COVID cases in Iowa. As confirmed by the governor and the Iowa Department of Public Health last night, we have one case in Polk County, and there is now community spread in our state. Community spread occurs when individuals have been infected with the virus in an area and cannot specifically identify the source of the infection or do not know how or where they became infected. The Polk County case is a middle-aged adult, aged 41 to 60 years old, that appears to be community spread. The person is recovering at home. Due to the detection of community spread, we are following the state's recommendations for individuals with underlying conditions, and all residents in Polk County should be prepared for cancellations and disruptions in routine activities. Individuals 60 years of age and older with underlying conditions should stay at home and avoid gatherings or other situations of potential exposures. Individuals should use personal social distancing measures, avoid large gatherings, and limit the number of attendees per gathering. The CDC updated its mass gathering guidance to postpone for the next 8 weeks any events with 50 or more people. Individuals should consider working remotely or using online learning when possible, encouraging staff to telecommute, and limiting non-essential work travel and gatherings. Governor Reynolds stated she is recommending all Iowa schools close for a period of 4 weeks to help mitigate the spread of COVID-19. We are asking Polk County residents to use good hygiene and health practices. We know that these measures, while they seem simple, are effective in preventing the spread of COVID-19. Those are and include: wash your hands often with soap and water. If soap and running water is not available, use an alcohol-based hand sanitizer. Avoid close contact with people who are sick. Importantly, if you are sick, stay home from work, school, and other activities. Avoid touching your eyes, nose, and mouth. Cover your cough or sneeze with a tissue and discard, or sneeze or cough into your elbow. Clean and disinfect frequently touched objects and surfaces using regular household cleaning spray or a wipe. Importantly, stay home if you have a fever until you are fever-free for 72 hours without the use of fever-reducing medications such as acetaminophen or ibuprofen. We need to, as a community, protect our most vulnerable. If you have a loved one with an underlying health condition or that is elderly, there are ways that you can help. Run errands for them, go to the grocery store, pick up their prescriptions, drop those items off at their doorsteps without the potential of exposing them to COVID-19, and do not visit them if you feel sick. The Health Department and Emergency Management, we have been preparing for COVID-19 since January. Some of the strategies that we have implemented since the event of COVID-19 has been on our radar include: we opened our Emergency Operations Center last Monday on March 9th. We have communicated and planned with our community partners, including schools, business, long-term care, and others, and continue to meet with them regularly to discuss operations and plans. We have developed, with our health system and clinic partners, a medical coordination center. This center allows the development of joint strategies to address the health needs of our community. Today, I'm pleased to announce a very important strategy and outcome of the collaborative work with our health system partners and clinics. Tomorrow, March 17th, starting at 8 a.m., Polk County residents will be advised to call 211 to answer medical questions related to COVID-19 instead of calling their local medical clinic. The Polk County Health Systems will provide trained nursing staff to answer the public's questions and provide telephone triage similar to what would happen if an individual would call a clinic. We are asking that the public call 211 and not their clinic for this kind of medical guidance. The medical call center at 211 will be staffed from 8 a.m. to 5 p.m. daily. As you can imagine, the call volume to 211 is high during this crisis, so callers may often experience significant wait times. However, all callers may request a call back without losing their place in line. Patients that have mild symptoms, questions about exposure to COVID-19, or questions about COVID-19 testing should call 211. If you have mild symptoms, do not go to your doctor's office, hospital emergency room, or call 911. Please call 211. Hospital emergency rooms and 911 should be reserved for patients experiencing severe respiratory distress. If you experience symptoms and cannot wait until 8 a.m. to call 211, call your provider after hours. We need the public to utilize 211 and the call center to reduce the strain on our healthcare system. This is an important step that we can take together for the health and safety of the residents of Polk County. Finally, there is a lot of misinformation that is being spread throughout the internet and social media. We want to direct the public to the most up-to-date, reliable sites for local information, and that site is the Polk County Health Department website. Residents should also utilize the World Health Organization, CDC, and the Iowa Department of Public Health for information. I know that the residents of Polk County are resilient, and the only way that we will get through this is together. If we come together and act responsibly and follow the outlines of the guidance that has been given, we can affect the impact of COVID-19 in our community if we come together and if we work together. Now, I will open it up to my partners to say a few words.
Thanks, Ellen. My name's Matt McCoy, Chair of the Polk County Board of Supervisors. On behalf of Polk County, our number one priority is our 1,400 employees and the public that we interact with and serve. At this time, Polk County is not closing our offices. We are making the following modifications to services in order to protect the health and welfare of the public as well as our employees. First and most importantly, Polk County services can be obtained online or by phone. We're asking the public to please call ahead before visiting the Polk County office building to see if your business can be done online. At Polk County Community Centers, we've closed the centers for activities and rentals. However, we are still distributing lunches and evening meals in a drive-through fashion. Please visit the Polk County Community Family and Youth Services website for a complete listing of those services and sites. Additionally, the Polk County Supplemental Foods and Food Pantries are modifying their delivery of services. At this time, Polk County Supplemental Foods can be obtained by calling ahead, and then we will provide you with instructions on where and how to access the food that you will need from a supplemental standpoint. All tax credit applications and protests from property tax assessments can be done electronically at the Polk County Assessor. Most services provided by the Polk County Recorder, Veterans Affairs, the Treasurer can be done online or by phone. So again, please do not visit the county office building without calling ahead. The Polk County Sheriff has closed the jail for all visitors. Inmates will get 2 internet visits per week at no cost. please call their office with questions regarding the temporary policy. We've increased cleaning and enhancement of all of our buildings and offices to try to contain any viruses, and we're taking the recommendations of the Polk County Health Department extremely serious. We are committed to protecting the health of our employees and the public. We're implementing a work from home policy for our employees, so it's critical that the public call ahead before visiting any of our offices. At this time, we will continue to provide services with modifications to protect the health and well-being of employees and the public. We'll continue to prioritize essential services to the residents of Polk County. I think Helen mentioned that there's a lot of misinformation on the internet, and we again ask you to go to reliable websites like Polk County Health Services, the Iowa Department of Public Health, and the CDC for accurate and timely information. We will get through this, and we are confident that together we will have the resources to ensure that all of the services that Polk County residents, and especially our most vulnerable, have depended upon will be made available for all to have. That's it.
Thank you, Supervisor McCoy. As he said, I'm Kevin Schneider. I'm your Polk County Sheriff. And we've got a few things that have changed within the Sheriff's Office. The first thing I want the public to remember is you are Iowa nice. Don't forget that. We'll get through this crisis as long as everybody stays calm and keeps a level head about them, and you take care of your neighbors. That's very important. I'm fortunate enough to have the best staff in the nation when it comes to the Sheriff's Office, and we've been working on this project for quite some time and are prepared to move forward. We have, as Matt said, we have closed the visitation at the jail. We're working with our vendors so that they can have internet visits, so the inmates will still get their visits and their family can still maintain contact with their loved ones, which is definitely an important piece of being incarcerated. We continue to evaluate everything that we have in place, and we know things are going to change as the days move on. We also have closed our field headquarters operation, which is located on Northeast 14th Street, to gun permits. You can do your gun permits totally online. There's no need to come in and be exposed or expose someone else to the virus. That is one of the other changes that we have in the protocol that we have. We understand, and all my staff understands, they are first responders. When you need us, we're coming, no matter what the situation. If you do your part to try and keep my staff safe, they're going to do their part to try to keep you as safe as possible. So we are looking forward to working with all of our partners, which we have been doing, the fire departments, the public health, emergency management, all the folks that we dispatch for and assist in on a day-to-day basis. So a lot of this information will be on the Polk County website and on our Facebook page. So if you have questions, you can get on there and they'll answer any questions, or a simple phone call to a non-emergency number. We'll get you somebody who can answer your questions as that goes along. But again, I encourage you to remain calm, remain polite, and remain normal as normal can be. And that's pretty hard to say. This is a very, very critical time. But the last thing we need is people getting excited and doing things that they normally wouldn't do. So keep that in mind. When you're feeling the stress, there's other people around you that are feeling just as much stress. So thank you very much. And if you have any further questions, you can feel free to contact the Sheriff's Office.
I'm glad you said all those nice things about staying calm. I'm Liz Cox. I'm the director of Polk County Health Services, and many of you know we manage the mental health and disability services here for the Polk County region. We did provide a small little press handout for you there with some emergency phone information on the back, so I won't go through those numbers with you right now. But we can expect that as people self-isolate, that they will experience some loneliness and depression. And certainly there is a fair amount of anxiety in our community. These sorts of emotions might cause people to feel tempted to use alcohol or drugs to help relieve their anxieties or depressions. We want to really encourage people to caution against that response. And instead, find some self-care. And unfortunately, speaking to the media, I'm going to say something you don't want to hear, but we would encourage listeners to take a break from the media. Take a breath, enjoy your family, get outside. Nature is a great reliever of stress and anxiety, and we all feel better when we spend a little time outdoors. We have many, many parks here in central Iowa that are just waiting for you to visit. Connect with your friends. This is an excellent opportunity to reconnect. Write those letters that you never have before, or you haven't talked to somebody in a long time. Find some safe chat rooms to connect with folks. So as we start to escalate in our worries, it's always helpful to have somebody to speak to. And as the sheriff mentioned, now's the time to really help one another. Iowa is a great place to live and raise a family, and I can tell you that this team standing here has been incredibly knowledgeable and patient and supportive in planning. We couldn't ask for a better leadership team working on the COVID crisis here in central Iowa. Lastly, I just want to point out that there are some resources available. So the Polk County Critical Incident Stress Management Team has a phone number, and that's again posted there for you to share with your viewers. But if things should get to a critical crisis level, the Broadlawns Medical Center crisis line is open 24 hours a day, 7 days a week for people who may be suffering from a mental health crisis to call and access. And there's also a suicide prevention hotline listed there. If folks are feeling as though they're going to harm themselves or others, it's always encouraged that they call 911.
Hello, I'm Christy Naus, President of the Community Foundation of Greater Des Moines, and joining me is Elizabeth Buck, President of the United Way of Central Iowa, who, as you know, also oversees the 211 program. Every disaster has unique and unanticipated needs that are not covered by local, state, and federal resources. We live in a generous community that truly cares for our neighbors in need. The Disaster Recovery Fund was created in partnership with disaster response and philanthropic organizations in Greater Des Moines to provide a collaborative and flexible option for donors to address the immediate and long-term needs of our most vulnerable populations. As our community and its most vulnerable neighbors are facing the effects of COVID-19, the Disaster Recovery Fund provides an opportunity for the public to give with the reassurance their donations will be used to quickly move resources where they're most needed and to adapt to evolving needs. The flexibility of the fund will ensure the community will be able to respond to needs that are not being met by local nonprofits, local funding, state and federal programs. The Disaster Recovery Fund, held and administered at the Community Foundation of Greater Des Moines, was created through a partnership with the Community Foundation, United Way of Central Iowa, American Red Cross, Central Iowa Chapter, Impact Community Action Network, Polk County Emergency Management, Polk County Community and Family Youth Services, and the Polk County Board of Supervisors. We'll work with our nonprofit partners to disperse the funds in a way that supports the community's most vulnerable residents. The Community Foundation's Board of Directors has committed $100,000 to seed the fund, and United Way of Central Iowa has matched that contribution with an additional $100,000. Throughout the weekend, additional funders have already stepped up, such as the Polk County Board of Supervisors, Mid-Iowa Health Foundation, Business Solver Foundation, and Cultivating Compassion, the Richard Deming Foundation Fund. To participate and donate to the Recovery Fund, please visit the Des Moines Foundation website at desmoinesfoundation.org/disaster fund. At this moment, we're focusing on providing a centralized fund for our donor community to contribute to. As we learn more about the availability of local, state, and federal resources and programs, the Disaster Recovery Fund Grant-Making Committee will issue further instructions about how these funds can be accessed to address the needs that are not being met by existing programs and resources. Funds that remain after the COVID-19 pandemic will remain in the Disaster Recovery Fund at the Community Foundation and will be used to address unmet needs in subsequent disasters. Long-term recovery work in our community will be ongoing, and it's the intent that this fund will continue to grow and serve as a source that can be activated quickly in the face of whatever our next disaster might be. Again, to donate, visit the Community Foundation website at DesMoinesFoundation.org/disaster fund. We may not know what tomorrow will bring, but thanks to the Disaster Recovery Fund, we have the confidence that we stand ready to meet the challenge. Our community has proven time and time again that we are better together, and this collaborative spirit will once again prevail as we support our neighbors who need us. Thank you.
Hello, Mayor, Frank County, City of Des Moines. I just want to reiterate to everybody, we are facing an unprecedented medical emergency situation in not only in and around Polk County and the state of Iowa, but across this country and around the world. And we have watched it, we've monitored it. It's been pointed out here with all of our partners at Polk County, at state, and Community Foundation to try to do everything that we could within our power. As of yesterday, the CDC announced that we had reached a new interesting point in Iowa, which is called community spread. That was outlined and defined quite clearly by our Polk County officials. With the power vested in me as the mayor of the city of Des Moines, we declared an emergency situation. Given the update that has occurred today with the 50 or more, we are going to amend that declaration to now limit that to 50 persons in one place. We will try to work as best we can with all of our partners to try to stay ahead of this and hopefully flatten the curve of the expansion of the disease here in central Iowa. And hopefully with all of us working together, we can properly address it and meet the needs of our citizens. At the end of the day, we as elected officials and all others working for the city and the county and the state, our responsibility is to protect the public health and the well-being of our citizens. And we feel that it's in the best interest of all of those to warn them of the risk of being out and about, to maintain good social distancing with at least 5-6 feet, maybe 8 feet away from those that are nearest us, and to observe that, whether it's our family members or it's good friends of ours or it's people that we meet in the general public every day. Let's try to maintain that, and let's do everything that we can to, again, work together to make sure this happens.